In South Korea, the death toll from the MERS virus has risen to 7 as thousands more are being quarantined. 8 new cases have been reported overnight, bringing the total number of infected people to 95. That makes the outbreak the largest outside Saudi Arabia, where the disease was in fact discovered. Both Hong Kong and Macau have issued travel warnings, urging people to avoid South Korea unless absolutely necessary. The World Health Organization says while the outbreak is big, it should not be cause for concern. Well, Gary Cremeri is a virologist from the Australian Animal Health Laboratory at the CSIRO, and he joins us in the studio now. Great to have you with us. Thanks for coming in. Saudi Arabia and, of course, camels is where this disease or virus originates, which is extraordinary. Give us a little bit of an understanding of how it all began.
Look, it's still not completely sorted out yet, but certainly back in September 2012, the first cases were identified. One of those was actually in the Netherlands, somebody who'd been in Saudi Arabia and had travelled back to the Netherlands. And since that time, we've had over 1,200 cases, all of which have been connected back to the Middle East, although a number of them have occurred outside of that region. It does appear that the virus is transmitting from camels into people. We're not exactly sure of that process, but it does appear that the virus is circulating in the camel population through that region.
Now, you've been doing some work here domestically on alpacas as a similar kind of species, I guess. What have you found about how it spreads within the animal community?
So one of our major tasks was to try and understand the virus and how it acts and infects camels, which are difficult to do. Camels are difficult animals to work with in a laboratory in a situation. And so alpacas are very similar in their physiology to camels. And so we thought we'd have a look, and no one else in the world had used alpacas before. So we thought here in Geelong that we would give that a try. And it turned out to be a very good animal model. They seem to suffer minor respiratory disease, which is similar to what others have seen in camels' infections across the world. So it's an upper respiratory disease, similar to a cold or flu.
But they don't die.
No, not at all. It's not lethal in camels. In fact, in camels and alpacas, they really show no signs of disease whatsoever. But we do see virus shed from the animals quite early in that disease.
So why do you think then in the transmission to humans it changes and it morphs into something different and so much more dangerous?
MERS is a coronavirus. Now, the other coronavirus that people will probably be aware of is SARS.
Yes.
Now, SARS emerged back in 2003. Now, they're closely related viruses.
Which is a respiratory virus.
That's right. Yeah. Very similar infections in the mechanisms that they're in. Most of the coronaviruses that we knew prior to 2003 were the ones that cause colds in people. So very minor, very mild. And so when SARS first emerged, it was disputed whether it could be this coronavirus that they'd found because they'd all been so mild. So with SARS, it was very rapid spread from person to person. So we had almost 8,000 infections in less than a year. Now, MERS is very different. It doesn't infect people anywhere near as quickly. It doesn't transmit anywhere near as quickly. It's one of the interesting or concerning things about the outbreak in South Korea is that so many people have become infected from what was a single original case.
Is this a potentially different strain then?
It's uncertain at this point in time. That's a possibility. It's also a possibility that the circumstances around the transmission culturally may be different. Certainly for diseases like Ebola in Africa, one of the compounding factors is the care of infected people, which helps to transmit these viruses onto others. That could be a factor in South Korea, but yeah, look, it certainly could be that the virus has mutated.
So really, it's not very clear how it is being passed on from person to person. I mean, it needs close personal contact, doesn't it?
Certainly, yeah, that's the case up until this Korea circumstance, and it probably still is the case. With SARS, the infection rate was much, much higher than it is with MERS. So we've been lucky in some ways with MERS so far that it doesn't transmit readily. It does take very close contact.
But still no cure?
Still no cure. And look,
Or treatment,
it's
yeah.
unlikely that there'll be a cure. SARS was contained with old-fashioned containment
measures, yes.
quarantine, and you know, there's every chance with this outside of the Middle East that it'll be contained in the same way. The difficulty with MERS in the Middle East is that it appears to be an ongoing infection from camels to people, whereas with SARS it was a single event from animals into people that then spread widely. So it's much more complicated, this MERS outbreak.
And therefore the control around really South Korea is just really for this outbreak. The ongoing issue is how you contain it from moving outside of Saudi Arabia continually.
That's certainly the case, and you know, one of the problems that and the reasons Hong Kong and Singapore have made alerts is that those hubs for international travel, of which the Middle East is becoming, you know, a bigger and bigger player, they are a major risk because they do pose that opportunity for viruses to travel to all parts of the world so quickly.
Gary, you've made it a lot more understandable, so we do appreciate that. Thanks for coming in.
It's a pleasure. Thanks,
Great
Beverly.
to have you with us.